Thank you for tuning in. You're watching Arirang TV's special coverage of the COVID-19 pandemic. I'm Min San-hee. The need for an internationally coordinated response to counter the virus has become more urgent. And in today's coverage, we touch upon present as well as possible global efforts to contain this contagion. But first, as always, I have our Kwon Soa and Noaram with the latest headlines. We'll start with you, Soa. I understand imported cases are still on the rise here.
Right. We had 36 imported cases today, and 18 of those were checked at the entrance checkups at the airport, and 18 others were reported through local districts, and really showing how necessary these new measures are. In total, we now have 242 cases in the country that seem to have occurred overseas. Out of the new 36 cases, 32 were South Korean nationals. Authorities stressed again how important it is for the individuals to abide by the government's measures. 8 foreigners were denied entry into South Korea Wednesday for refusing to follow the 2-week isolation period. Along with these imported infections, sporadic cluster transmissions are the major source of ongoing cases, which is why officials are in discussion of providing a sustainable guideline on social distancing measures soon. Now, let's take a closer look at the numbers, today's figures. The total number of confirmed cases stands at 9,976 as we have 89 new cases, and the death toll stands at 169 in the nation. Now, what is a relief is that just as fast as figures have been rising just last month, now we are seeing a fast increase in people fully treated from the virus. Less than 4,000 are now in quarantine. That's the first time that that has happened in a month, and more than 5,800 have now fully recovered. Now, by region, the capital Seoul and surrounding Gyeonggi-do province have 14 and 17 cases respectively, mainly due to cluster infections at hospitals and churches, and Daegu reports 21 new infections.
I see. So I understand that the situation overseas is getting even more severe.
Right, and that because we have now more than 930,000 cases that have been recorded around the world, with at least 46,800 deaths. And I don't want to make that prediction, but it looks like we are alarmingly nearing 1 million. And I don't have to be the one to make that prediction, because in fact the World Health Organization says that it's likely to happen pretty soon. And the United Nations, meanwhile, also made a prediction which said the global economy could shrink by almost 1% this year, given the grave situation. And one of those serious situations can be seen in the U.S., where more state governors have issued stay-at-home orders now, with 87% of Americans under those orders as of Wednesday local time. U.S. President Donald Trump, however, does not appear to be considering a federal stay-at-home order yet. At the latest COVID-19 briefing, he meanwhile acknowledged the stockpile of personal protective equipment is almost depleted. Meanwhile, the U.S. is now also mulling over the need of masks, even if you do not show symptoms, due to the growing concern of no-symptom carriers that have potential to spread the virus. And Aram is probably going to talk about that. The WHO is also considering that as well. Now, for a closer look at the figures abroad, the daily number of deaths stood at over 1,000 in the U.S. Now, with the total number there at more than 213,000, and Spain's cases now surpassed the 100,000 mark as well. And we don't have Turkey on the map. It looks like right behind Switzerland now, Turkey has almost 16,000 cases as well. Yes, and that is all I have for the international updates today.
Okay, so thank you for that. Aram, meanwhile, the first group of Koreans from Italy have arrived, and we're expecting a second group. When are they coming?
Yeah, so the second chartered flight is scheduled to arrive at Incheon Airport in a couple of hours' time, actually, and around 4 p.m. today, after departing from Rome and Milan on Wednesday. So they will be here shortly. There are about 200 people on board that second chartered flight, and they follow some 300 Koreans who, as you said, arrived yesterday, and they Those 300 odd people are staying at a government-run facility in Pyeongchang for COVID-19 testing. After the latest group land in Incheon, they will undergo COVID-19 testing at another state-run facility, but in Cheonan. And if anyone tests positive, all will be subject to 14 days of mandatory quarantine at the facility. If all test negative, they will be required to self-isolate at home for 2 weeks, so they will still have to be away from the public for 2 weeks either way. There are also other Koreans in Europe on their way back as well, including those from Germany and Poland.
I see. Aram, there was some debate among global health experts about the wearing of a mask. The WHO had said that healthy people do not need to wear one, but I understand their stance is about to change.
Yeah, so this debate has been going on, and as Soa said earlier, the US is mulling the decision of changing its recommendation for the public to wear masks as well, and the WHO is also considering changing its guidance on face masks as new evidence suggests that wearing them in public could help contain the pandemic. And the WHO and some governments, including the UK and US, are currently advising that face masks are not really helpful in preventing the spread of coronavirus outside of the healthcare setting anyway, so mostly restricted to medical staff, and even if healthy people do wear masks, it's only for people who are caring for those who are showing symptoms. And as we know, it's rather the opposite in many Asian countries, including here in Korea, where wearing a mask has pretty much become the new social norm, and even some buildings won't allow people if you're not wearing a mask at all. And this is said to be helping in containing the outbreak, which has led to growing calls for the WHO to revise its guidance on the matter. And the organisation will discuss the matter in the next 24 hours to decide whether to change its stance and recommendation. The discussion is also taking place because a recent study shows that droplets expelled after a person coughs or sneezes, which is the highest concern of or the highest likelihood of transmission of the disease, can actually travel further than initially thought. And people have been advised so far to keep a distance of about 1 or 2 meters away from each other. But this study shows that these droplets that carry the virus when we cough or sneeze could actually travel up to a distance of 6 to 8 meters. So that's why I think wearing face masks has become a much more likelihood in the public. Yeah.
That's really scary, actually.
It is a scary figure, yeah.
Okay, meanwhile, Japan is adopting some drastic measures to curb the spread of the virus in its country.
Prime Minister Shinzo Abe has announced that Japan is expanding its entry bans from Friday to stem the spread of COVID-19. It had already barred arrivals from countries like South Korea, China, and European hotspots such as Italy, which has been severely hit by the outbreak. The ban has been expanded by an additional 49 countries and several regions in the Americas, Africa and Europe. That makes it a total of 73 countries now that are subject to the measure, and foreign nationals who have been in those parts of the world within 14 days of their arrival in Japan will be refused entry, and all travellers to Japan, including its own citizens, will have to be self-isolated or are being asked to avoid public transport for 2 weeks as well. Other COVID-19 countermeasures being undertaken by the Japanese government include handing out cloth masks to each household in the country. So that adds up to about 50 million households that will get 2 cloth masks each, which are reusable, so they don't have to have disposable ones. And Prime Minister Abe has certainly been stepping up his efforts because he has been coming under fire for his somewhat slow response in the initial stages of the outbreak. And we actually saw the Prime Minister wear a face mask in a parliamentary session yesterday, which is known to be the first time he was actually wearing one in a public setting. So I think he's kind of realizing the scale of the problem now.
Right, I see. Okay, Aram, thank you for that. You'll be back tomorrow with Soa for more on the headlines. It's time now to join the Central Disaster and Safety Countermeasure Headquarters for the regular briefing on the COVID situation in Korea. While we wait, just a reminder to our viewers about the 2-week self-quarantine period that has been put into place on all arrivals to the country. As of yesterday, the 1st of April, regardless of your departure points, officials have vowed to take a stern approach to those found breaching the self-isolation rule. Violators can face a prison term of a year or a fine of up to 10 million won. Now, foreigners can face deportation as well. We're still waiting for the briefing. It's going to start in a few seconds.
네, 그럼 4월
Meanwhile,
2일 목요일
it's starting
정례
now.
브리핑
We'll come back
시작하도록
after the
하겠습니다.
briefing.
먼저 권준욱 부본부장의 설명이 있겠습니다.
Here is Mr. Kwon Junuk.
Let us now begin our regular briefing for April 2nd, Thursday, on the coronavirus outbreak here in South Korea. The total number of confirmed cases stands at 9,976. This includes 601 imported cases from overseas. 50 of them were foreigners, and most of them were Korean nationals coming back to Korea. Of them, 5,828 have been discharged following full recovery. We had 89 more cases from yesterday, and 261 more people were discharged. So we see a gradual increase in the number of those being discharged. Unfortunately, we had 4 more deaths, and the regional breakdown of the confirmed cases is as follows. In Daegu, we had the largest number of 21, and airport quarantine 18 cases were reported. Nationwide, 83.3% were related to cluster infections. And looking at the individual cases, at the Asan hospital at Songpa here in Seoul, we had one patient. That's the only confirmed case right now. However, we are currently tracing the contacts. And in Daegu, we had 2 hospitals, which are Daesil Nursing Hospital and Second Minju Hospitals, which saw 13 more cases from the day before. Moreover, we also have at Daegu the Hansarang Nursing Hospital, where we confirmed 2 more cases, and the total stands at 123. And at the Uijeongbu St. Mary's Hospital in Gyeonggi-do Province, we had 9 more cases yesterday, and starting from 29th of March until now, we have 22 confirmed patients. And in Gyeongnam, in Jinju, we had a spa, and from 28th of March until now, we have 7 confirmed cases, and we are screening those who have come in contact with these people. And the government has been witnessing a continued sporadic increase of the imported cases, and therefore we have strengthened our measures for those who are coming in from abroad, starting from midnight of April 1st. All of those who are arriving from overseas are mandated under the self-quarantine for 14 days upon entry. Foreigners on a short-term visit, they will be subject to facility quarantine, and they would have to pay for their own expenses. And for those who are coming into Korea from overseas, they are advised to return home straight after arriving at the airport, and they are advised to use their own vehicles or designated airport limousine buses or designated KTX train. They need to abide by the quarantine measures, and all of those who have come into Korea through other parts of the country who are not subject to the mandatory self-quarantine for 14 days. However, we still advise that all of these people stay at home as much as possible and wear face masks within their homes to minimize any infections among the families. The Welfare Ministry here in Korea has designated Dr. Sung Baek-nim from the Yonsei University, and he will be receiving funds of up to 256 billion Korean won to develop the vaccines for the coronavirus, as well as other diseases, including tuberculosis, for the next decade. And we believe that this will be very helpful for developing the vaccines and therapeutics for the coronavirus. And also, we had within our new extraordinary budget, supplementary budget, allocated budget for the development of therapeutics for coronavirus. And the government, since March 22nd, we have been promoting the enhanced social distancing campaign. We are advising the public to refrain from any other social gatherings and outings, especially those that are carried out in very close contact with other people in enclosed spaces. We believe that this was very helpful. And for instance, in Bucheon at the Saengmyeongsu Hospital, 4 people were working at daycare centers. However, luckily, this daycare center was on a temporary close. Therefore, we were able to curb the further spread of the virus. And at the Manmi Central Church, even though they had online services and even though they did not comply with the rules, the quarantine rules perfectly, we have seen some sporadic cases. However, we believe that these numbers could have increased even more if they did not abide by the enhanced social distancing campaign. These are some effects of the campaign. From the press kit that you have with you, from the attachment 3, you would see the death fatalities of the coronavirus. We have 169 fatalities so far. I would like to extend my deepest condolences to those who have died and the bereaved families. And we want to make sure that the fatality rate is about 1.69% right now. The age group was about 77.4, the average of the age, and a lot of them, a majority of them had underlying illnesses, and most of them were related to cluster infections. 64% of them, 7.7% had contact with the cases, and 0.3 were related. Were also reported. And from as for the underlying diseases, there were diverse diseases, including diabetes and mental illnesses. And that was the updates of the coronavirus outbreak as well as the fatalities. Thank you very much.
Right, and that was Kwon Junuk, the vice head of the Central Disease Control Headquarters. Korea has recorded 89 new cases as of early Thursday, bringing the total number of infections here to 9,976. Authorities here remain wary of cluster infections and imported cases and have thus called on members of the public to refrain from non-essential activities that confine them to crowded indoor venues. Now, the COVID-19 pandemic has crippled daily life routines. And we've spent quite some time talking about the impact on adults, but what about the children? How are they coping with the containment efforts, with the inability to go to school, play sports, and just hang out with friends? Well, in this next video, we take a glimpse of just that from a Korean student studying in Washington, D.C., who took the footage himself and sent it to us to share, with the consent of his parents, of course. Let's take a look.
Hello, my name is Jiwon Park, and here in the United States, I use the name Randy as a nickname. Before coming to the United States, I was a goalkeeper for Incheon United, and now I am playing and training for DC United as a goalkeeper. Currently in the United States, there are more than 160 cases confirmed and nearly 3,000 deaths. Just in Washington, D.C., there are more than 400 cases confirmed. Here in the United States, the government does not send out text alerts like South Korea, but they do inform us through news and letters like this one. Like any other states, Washington, D.C. has issued a stay-at-home order for the safety of residents, so I've been staying at home since the first week of March. Fairfax County Public School has decided to finish the school year, and they're planning to start online classes on April 16th. Once a week, my soccer team meets on an online video chat. We talk about how to keep our body fit during the break. These are some of the workouts and exercises I do. Online classes is better than not learning anything, but I would prefer the classroom environment. We practice a lot of team building skills through video chat and we keep in touch a lot. I've never seen the streets so empty. At this time of the year, we're supposed to have a lot of people taking photos, talking below the cherry blossoms, but now it's just all empty. Costco's in Virginia. As you can see, people are standing in a line 2 meters apart from each other. Most of the people have gloves and masks on. Here in Virginia, most of the people do this no matter the race. So as you can see, this is the food court, just empty, nothing. Yes, they keep the lights on to keep the place a bit more light, but nothing working around here. It's just all shut down through government orders over here too. So yeah, that's the situation right now in these Asian marts. The places are all closed down due to a shutdown ordered by the government. So these are some of the emergency products that we have at home. For example, we got some rice, water, toilet paper, masks, Clorox, some spray, hand sanitizers, and gloves. Hand sanitizers, masks, and toilet paper were really hard to get. My parents ordered them a month ago and they just came last week. So this used to be one of the practice places I used to practice a lot on, but as you can see, they closed it down. Fairfax County, they've closed all public parks and places due to the coronavirus. So if you go in illegally, like climb over the fence, you could have a fine. I would like to thank all the healthcare workers and others on the front line fighting the coronavirus and caring for patients. I'll do my part and practice social distancing. I hope things go back to normal quickly so I can go back to school and play soccer. Stay healthy and safe, everyone. Thank you.
Right, and that was Randy with scenes from his daily life in the US amid the COVID pandemic. For those of you seeking to share your stories in light of the virus, please feel free to contact us through our homepage, arirang.com, or our social media accounts.
COVID-19 response has become the top priority for governments around the world.
방역과 경제 모두에서 글로벌 공조가 아주 절실해졌습니다. 우리 기업의 진단 역량이 글로벌 공조에 큰 역할을 하게 될 것입니다.
On March 26th, the leaders of the G20 gathered for an unprecedented video conference to coordinate a global response to the pandemic. They discussed ways to work together on public health, quarantine, and financial measures. With an outpouring of requests for aid from countries worldwide, South Korea now has an opportunity to lead the international fight against COVID-19. We discuss coordinated global efforts to win the war against the virus and South Korea's role in the global response.
The COVID-19 pandemic calls for solidarity and a coordinated global response. It also presents an opportunity for Korea to facilitate global efforts given its relatively effective and transparent handling of the crisis so far. For more on this, we have visiting Professor Junseong from Yonsei University. Welcome, Professor
Thank you.
And we also have Frank Smith, correspondent for Deutsche Welle. Hello, Frank.
Nice to be back today.
And we connect live to Professor Kelly, Robert Kelly, that is, from Busan National University. Hello, Professor Kelly.
Hi, thank you for having me.
First, Frank, we'll start with you. Following their virtual meeting last week, leaders of the G20 summit made a joint declaration on the COVID-19 situation. I believe this is the first of its kind since the 2008 financial crisis. What do you make of the joint declaration, Frank?
Well, I think it's great that the international community got together and made this declaration. However, I am concerned in terms of implementing it. Much of it was earmarked at the contribution that countries around the world would make, but those contributions are still voluntary, and we need to keep our eye on making sure that the international community and individual countries honor their commitments to fund the battle against the coronavirus.
Right, Frank. Professor Ahn, it's clear that the leaders of the G20 are taking the crisis very seriously. What meaning does their meeting have for the international community?
Yeah, before we talk about G20 summit meeting, also there was G7 meeting, right, earlier. And as you can follow with the news that there was some issue, there's disagreement among the members, especially the US government tried to put like, Wuhan virus, and then there was some problem in the State Department with other, UK and French government. And there was issue. And then now we have much better situation because G20 is actually a great number. We have 20 member countries, right, compared to 7. Also G20 including China. So that means that China is they have experience, right? I mean, their situation is getting reportedly getting better, and I guess they can share a lot of information about how they handle the situation. And plus that, each country have different condition, like healthcare issue, also the the national, the system, like I think that's the things that we can share more information on, depends on more like a customized and different situation. I think that's the good point because we have more member can share to more information.
Right. Professor Kelly, in the joint declaration, the G20 leaders vow to work together to battle the pandemic and to ease the economic fallout from the virus. What do you believe is the most pressing issue with regard to coordinating a global response to COVID-19?
Probably the sharing of resources, specifically the protective equipment that's really sort of shown up, where shortages have shown up really sort of all over the place. The supply chains for these things are spread globally, right? I mean, China's role in the supply chains for the production of medical equipment has become a pretty big issue in the Western media in the last couple months, right? And so that gives China a certain amount of leverage in these instances, right? This is one of the reasons why China's been getting some good press in Europe recently. But, as long as you have these interwoven global supply chains, it's really important that everybody stay on the same page, that everybody cooperates so that we can continue to produce this stuff and it can be moved around from one part of the world to the next as the virus hits, right? I mean, what nobody's really talking about at all is that when this thing hits the global south, when this thing hits Latin America or Africa, for example, right, the death tolls are going to be very, very high. And all this stuff that we're producing now is going to have to be shipped south, or it'll be really catastrophic there, right? And the G20 didn't mention that at all, of course, because they're only thinking about themselves.
Professor Kelly, historically, the U.S. has prided itself on being a leader in tackling infectious disease, but there are concerns that the country has failed to respond adequately to COVID-19. Granted, preventing the further spread of the virus in its own country is its priority right now, but surely its role in international collaboration is also just as important. What are your thoughts?
My thought is that is at this point kind of pre-Trump thinking, to be perfectly honest. Donald Trump just doesn't care about this stuff. And we're 3.5 years into his presidency, and we've been waiting for him to sort of assume the traditional role of American leadership in the world. And he just doesn't want to do it. He just doesn't want to make the sacrifices. He doesn't want to put in the time. He dislikes a lot of American allies. He thinks they're stealing from us and ripping us off. You can see that in the special measures debate here in South Korea. I think it's time the world started to adjust, particularly if Donald Trump gets reelected, to the fact that the United States is actually not going to play that role, that the United States believes, at least under the Trump administration, that U.S. leadership means that foreigners free ride off of the United States. I don't accept that critique myself, and I think most of the Americans you'll meet who live outside the United States would disagree with that too. But that's sort of where the Trump administration is going, and you really see that here, where the Trump administration has basically provided no leadership whatsoever for this, right? I mean, it was the South Koreans who wanted the G20 meeting, not the Trump administration, which makes no sense at all. But I mean, that's where we are now. I mean, this is the man who's president.
I see. Hopefully it will change. Frank, quite a number of foreign media outlets use the picture of President Moon Jae-in speaking at the G20 summit to report on the meeting itself. Do you suppose this holds a symbolic meaning?
Well, of course it does. We've all seen the news and we've all seen the graphs, and here in South Korea, we've experienced it. South Korea has responded to the COVID-19 pandemic, in exemplary ways. If we look at those graphs, for example, you see the graphs of cases of other countries, the United States, Italy, Spain, Iran, for example, and you see the graphs go up to the tens of thousands, hundreds of thousands of cases. In South Korea, that graph is flat, and they managed to really preempt the increase, the exponential increase that we saw in cases that other countries have experienced. So it stands to reason that other countries, and they are, should definitely be looking to South Korea for the way that they responded to the coronavirus outbreak.
Professor Ahn, according to the Foreign Ministry here, a total of 117 countries have asked to export Korea's quarantine products or to provide them as humanitarian aid. Of these countries, Korea has placed the US, the UAE and Indonesia at the top of the list. What diplomatic factors may have played a part in this selection?
Okay, if we talk about actually specific the factors, I think with the big picture, so according to the Minister of Foreign Affairs was 117, but actually if we break it down, actually there's the quarantine product request was the 31, and the humanitarian aid was 30, right? And then the request for both it was 20, so add up in 81. So the rest of 36 countries is the going for the unofficial line, and they're using the companies, Korean companies to ask. So I guess you see that there's number, just 81. I guess it should be the official channel. And for the why they select the U.S., UAE, Indonesia, I think according to the Foreign Affairs, right? The Minister of Foreign Affairs, U.S. was, as you see, that's explosive growth rate and the infection rate in the United States. So that's very serious. Also, the US, both countries very strong, alliance. Not only military, also the economy and socially, right? So that's the issue. Also, President Trump had a telephone conversation with President Moon Jae-in, and he personally asked for the help. So I guess that's the right choice to make it. Also about the Arab Emirates, but the Foreign Affairs didn't really specify why they did it, but I think that they have a strong business tie with the Arab Emirates, including like a nuclear plant export to UAE, first time ever. And about Indonesia, Indonesia is the one of, I guess the Minister of Foreign Affairs see that Indonesia is the key member country of the new Southern policy in the Moon Jae-in administration.
Right. Professor Kelly, Professor Ahn talked about talks between President Moon Jae-in and President Donald Trump. So we can see collaboration between Seoul and Washington regarding the COVID situation are well underway. And coming along with that, they reached a tentative agreement on deadlocked defense cost-sharing issue. Do you suppose there was, how do you see this relating to the COVID situation?
Almost certainly. I think that's probably why the South Koreans put the Americans at the top of the list, right? I mean, the United States easily has the resources in both money, bureaucratic depth, state capacity, medical care to take care of this, to respond to this itself, right? I mean, if we're really going to direct resources between countries, what we should do is direct them, like I said before, to poorer countries that really don't have a lot of the services that exist in the wealthy parts of the world. I mean, it's kind of ridiculous if you think about it that South Korea is supporting the United States in a pandemic. It should be all of us supporting poorer countries who really need the assistance, right? But I mean, it's obviously being driven by politics. The SMA debate has been really, really sharp. The South Korean government isn't really ready for a retrenchment of U.S. forces from South Korea. I mean, that's the kind of, I think, the brink that the Trump administration is pushing the South Korean government toward. And I think this is a way to sort of rein that back in, right? I mean, you're just seeing in the media right now that we're close to an agreement. That's what people are saying now. My guess is that almost certainly has to do with this, right? Which is that South Koreans saw sort of a unique moment of opportunity, right? South Korea's done a much better job with this than the Americans have, and they leveraged that wisely, to my mind, in order to get, greater American compliance, better American behavior on the SMA talks. I mean, we don't know, right? It's all taking place behind closed doors, but I mean, it's awfully coincidental.
Professor Kelly, in light of the current circumstances with the COVID crisis, government's ability to keep its healthcare system on track, to engage in diplomacy productively is being put to test. Do you believe Korea is doing its part? Well, I mean, you've praised the country quite a bit.
Well, I think that Korea sort of showed that democracies can get on top of this without doing what the Chinese did, right? Or what the North Koreans are probably doing, right? Which is basically locking people in their homes and using state repression to prevent this from spreading. We don't want to do that, right? And we're democracies, right? You don't want to tell people they can't, go to church and they can't leave their homes and they can't talk to their friends. And, if they get the virus, they're going to go to prison. I mean, we don't want to do that, right? And South Korea has sort of shown that and sort of shown that we can get this, actually sort of beat this thing down pretty rapidly, right? I mean, you can already see South Koreans here in Busan walking around on the streets without masks on and stuff like that, right? And I think that's really sort of been the model, right? The debate then, I think, and this is what your other guests have mentioned too, is how much of that can be exported, right? I mean, will Americans, for example, comply with government recommendations for behavior the way South Koreans will? And the answer is probably not. You saw those Americans going to the beach and stuff like that and getting drunk and talking about how they get corona. It's no big deal. I mean, there are parts of what South Korea has done which can be exported and parts not. And we need to sort of figure out what is culturally and institutionally acceptable in other countries because, you know, the rest of the world isn't going to be like South Korea.
Right. Frank, there are growing calls for the need to lend humanitarian assistance to isolated countries such as North Korea and Iran. What do we know about the situation there regarding the COVID-19 pandemic?
Well, I'll start out with Iran. Iran had sort of a bad sort of coincidence take place in February. It had the anniversary of the revolution on February 11th and a call for hundreds of thousands of people to come out into the streets on that day. And then on February 21st, it had national elections. So that really affected that initial curve of the contagion in that country. Also, Iran has an adversarial relationship with the United States, and it seized on remarks made by the Chinese Foreign Ministry suggesting that the coronavirus may have been imported into China by the US military or some such rumor or sort of fake news like that. And even the president of Iran, Rouhani, mentioned that it may be some type of foreign attempt to overthrow or affect the revolution there. So that has really affected Iran's response to the coronavirus. They've had 3,000 deaths and 50,000 cases now. It's a pretty bad situation there for sure. In North Korea, it's a little bit different. As Professor Kelly mentioned, North Korea has a totalitarian regime. They shut down the border between North Korea and China fairly early on. But the information that we're getting out of North Korea from various aid organizations and NGOs is a little bit spotty. So the degree to which the coronavirus is affecting North Korea, although probably less, is less known.
Frank, international media outlets have been highlighting the importance for a global response to the pandemic. What role do you suppose Korea can play in this fight? I mean, Professor Kelly highlighted the country's initiative in calling for the G20 virtual summit. What are your thoughts, Frank?
Well, I think South Korea can play a tremendous role given the effectiveness with which they responded compared to other countries. The three things it did, test, track, and isolate in terms of those that had contracted the virus, had a remarkable effect early on. I met a young man that created actually a tracking an application that people could use in 3 languages to find out where people had been infected. Now, this involves somewhat of an impingement on people's privacy. And I think providing a lesson to Western democracies that hold that privacy, and especially the United States, that hold that privacy so dear, providing the lesson that a sacrifice of some of that privacy will result in, perhaps a remarkable saving of lives is something that Americans might be able to look at.
Professor An, Korea has been widely praised for its response to the coronavirus, and this is a great opportunity for the country to perhaps raise its global standing. But along with that, of course, would come greater responsibilities, greater role. What are your thoughts?
Yeah, actually, my first comment is that I was very impressed how it's not only government, like the Corona map application stuff. It's like, I see that Korea is kind of developed. We know that Korea as a society or country, very developed in IT technology, right, information technology. Also, I see that this time, in terms of biotechnology, like healthcare, I was very impressed because they're very well. And then even the coronavirus, Corona app is more like, how the IT connect to the, how they do it. Not it's really the biotech itself, but it showed them information that we never had it before. Something very creative ideas and because it could possible because we have a very developed IT infrastructure, also the biotechnology, and also about the greater role in the international community. It's like I guess I checked the Blue House website last night about how they promoted there. I was surprised they put a YouTube, video. It's very informative, and I enjoy it. But I think that the one of the things we can do here more effective is that the other country government is more interested on more details. I guess we should get more documented, more get document, like say, for example, like a global manual, how to prepare. But as I discussed, I talked earlier that it's like Korean experience is not going to work to all countries. There will be different situations. So we should come as a manual and a global manual, and then how to do, what to not to do, right? Something. I think that would be very effective. Also, about in terms of global leadership, I have a little bit concern because that Korean government tried to do chasing two rabbits at the same time, because they try to use this opportunity to commercialize the Korean product exportation to that country. At the same time, they try to send humanitarian-based aid, right? But my concern is that if the government tries to push on more commercialization side, I'm concerned that other international community might see that the Korean government, Korean countries try to take advantage of the situation, pandemic situation. So my suggestion is that maybe we should focus on more the humanitarian side, and we'll try to give first before we try to get it back, right? So that's my position then.
Professor Ahn, countries are chartering flights to bring their nationals home. We just have a group from Italy come back home. What are the diplomatic considerations that need to be made in arranging these chartered flights?
I think that's the international relation issue, right? Because many countries actually already prevent foreigners coming into their country, or they shut down their airport system, right? So the problem is that some other countries in Africa, I think that happened, and the Korean government have to make a the partnership with other countries like French and U.S. government to get people to get the chartered flight, because you need to minimum 100 number or something like that. So I think that's the many types of cooperation opportunities, and you can show our not only leadership, it can more like a teamwork, right? We show we try to be team player, try to be you're not trying to be a leader, or at least we try to do help, and as a partner. I think that's a good sign to the international community. South Korean government can give now.
Right. Professor Kelly, the COVID-19 crisis has brought renewed attention to North Korea-US relations. Now, if Pyongyang accepts Washington's offer for help, do you suppose this could lead to a resumption of long-stalled discussions between the two sides?
Maybe at the working level at best. I think at the summit level, which is what the North Koreans sort of expect, right? Because Trump gave them 3 summits in a row, in like a year and a half or so. I think at this point, the North Koreans aren't going to meaningfully negotiate with the Americans unless they get to talk to President Donald Trump himself. Trump has sort of opened that door, and I'm not sure it can be closed again. So I think maybe giving some COVID assistance will maybe restart the working talks, but there won't be any breakthrough until Kim actually gets to have another meeting with Trump, and Trump isn't going to do that unless he feels that North Koreans are going to make major concessions. So I would imagine that maybe this will sort of help kick things along at the middling level, but at the summit level, which is what the North Koreans really want, no, I don't think it will.
I see. All right, well, the fight is far from over, but let's hope that a strong global approach to the pandemic will ensure the loss of less lives, less infections, and more recoveries. In the meantime, thank you, Professor Kelly, thank you, Professor Ahn, and Frank Smith for being with us today.
Thank you for having me.
Right, that brings us to the end of today's coverage of the COVID-19 pandemic. We'll be back tomorrow with more at this hour, so do join us then. Arirang TV welcomes your thoughts and inquiries, so be sure to check out our homepage at arirang.com or do follow us on our social media accounts down below. In the meantime, do take care and stay safe.
안녕하세요. 축구선수 손흥민입니다. 방탄소년단분들 덕분에 응원의 메시지를 전달하게 되었습니다. 감사합니다. 우선